Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the sequencing of study if you are trying to do independent study to become a medical coder. Now, if you are new to my channel, welcome. I am Blue. I am a medical coder. I have been a medical coder for over 10 years. I created my channel with the hope of sharing the things that I know with veteran medical coders and brand new medical coders and people that are considering about getting into the medical coding field. Now, I will talk about the sequence of study, at least what I would suggest. And then at the end, I'm going to talk about some advice that I have for people who are perhaps on the fence about studying medical coding. So let's get started. All right, now, the first thing is first, you need to set yourself up on a schedule. If you are doing independent study and you're trying to bypass all of the trade schools and you don't want to go to college, or you don't have the money to go to college, is totally understandable. College is super expensive, but even trade schools are expensive as well. Now, if you're trying to go the independent route, it is totally possible to do it on your own, even with no experience previously in medical, but you have to be committed and you have to be disciplined. If you lack in either discipline or drive and focus, you really have to work on that. But set yourself up a schedule. Decide if you want to spend a year studying and then take your exam, or if you want to spend 6 months studying and take your exam. I went to a trade school, but in the trade school was supposed to be like 9 months. I made it through in 6 months. But I was very determined because I wanted to just get through school and get started working right away. And I will probably leave a link to how I got my first job somewhere in the cards or down in the description box. And I will be leaving a lot of links down in the description box. So please be sure to check the description box below. It's going to have lots of information for you to go to if you are looking to do this independently. Now, I didn't have any previous background in medical, but I was driven, and that was what helped me. You have to stay focused because it's easy to sort of start to let your energy sort of lag if you're letting other things distract you, whether it is kids, family, a spouse, a partner, whatever the case may be. There's many, or even another job. There may be many distractions, but you have to stay focused on what you want, okay? Now, this is the order that you should be studying, okay? Now, there's some books I'm going to talk about at the end as well, some specific titles, but you have to make sure of this big, huge thing, okay? You need a diagnosis book, an ICD-10 diagnosis book for the current year, okay? Now, I say current year because these videos live on in perpetuity, and you need to have the current year. This year is 2020. So if you're trying to think about doing it this year, if you're going to complete the entire thing this year, then get yourself 2020 versions, okay? If you are going to do it next year, obviously they're not out quite yet, or there may be like a waiting list time, whatever. You can use this year's current stuff to study with, but know that when you take your exam the following year, you may need the latest year version. It just depends. There's a little bit of a lag time with AHIMA, the American Health Information Management Association, where they do allow the following year, there's going to be a cutoff time that you can use the previous year book. So make sure that you pay attention to that, okay? But you need an ICD-10 diagnosis book, and you need a CPT or current procedural terminology professional edition. There are two different kinds. There's an expert edition and there's a professional. You need the professional. Whether you are taking the exam for AHIMA or AAPC, which is the other medical coding association, the American Academy of Professional Coders, both of them require that your procedure book is the CPT professional edition, okay? So just going to say that part right there. But those are your two main books that you need to study with. I'm going to list some other titles at the end or towards the end of this talk. And so that way you guys can go from there. But yes, you absolutely do need that. You absolutely do need a medical dictionary, okay? Because you're going to have to start learning a lot of medical terminology, okay? You're going to need an anatomy and physiology book. And any anatomy physiology book, it really will do, because like the body has not changed, the disease process has not changed. And so you can learn a lot from just basic books. Now, of course, with everything going on right now with the pandemic, libraries are not open. But you can try to find cheap books online. You can try to just look and see what you have. Lots of people have books in their house and that they never even read, or like just different things. So just make sure that you try to look for resources that are around you, okay? So that way you can try to learn. But, okay, so here we go. The first thing you need to learn is your anatomy and physiology. That's what you need to learn first. So you need to learn the bones, you need to learn the muscles, the tendons, and the internal organs. You need to learn all of those things, okay? I did do a video where I talked about study tips. Again, I will probably put it down in the description box so that way you guys can just link it, because the cards, while easy, will click you out. And so I think they're a little bit distracting, so I'll just put them down at the bottom. But yes, also check the playlist, because I do have lots of playlists with lots of good information as well. I have so many videos, you guys. And so be sure to research the videos before asking questions. I don't mind questions. I welcome questions all the time, but please make sure that you've gone through the videos and seen if I talked about it before, okay? The next thing you need to learn is, or you can learn it simultaneously, is medical terminology. Now, if you have a really good base foundation of anatomy, physiology, and medical terminology, you are already doing really good, because you have to understand the organs in the body, the parts of the body, the bones of the body. You've got to get this part first before you move on and you start to try to look up codes, okay? So I'm just saying that part first. And then you can get a book on pharmacology, so that way you can sort of get a good idea of roughly what medications are these, what are your insulin medications, what are your anticoagulants, what are your antiplatelet, what are your cardiac drugs, what are your just different medications for different conditions. So make sure that you're familiar with those, you're familiar with some of the names, okay? Then you're gonna study some computer basics, okay? You can make sure that you know how to use Excel, make sure you know how to use Word. If you don't know how to use PowerPoint, the great thing about YouTube is that they have so many tutorial videos about Word, Excel, and PowerPoint. So if you're interested and you want to study it because you want to prepare yourself, that's a good place to go to as well. I'm not saying that that's going to be on your test. I'm just saying that this is going to prepare you for when you do get out in the real world and they do ask you, what are your computer skills? And you can say, oh, I know how to use Word, Excel, and PowerPoint. Now, I didn't learn how to use PowerPoint until a couple of years ago, but only because I had recently started to use it at that time. So that's just something that I will suggest, okay? Check YouTube for additional study resources. All these things that I'm telling you, there's people out there that have done other videos on these, okay? Now, I'm not going to suggest any because I'm not going to sit there and plug somebody else's channel, but I'm just saying, and I don't do that because I haven't reached out to the person. That's the only reason why I haven't. But you can check and see if there's other YouTubers out there that do this. Also, you can look and see if there's an app for like medical terminology and anatomy and physiology. Don't ask me on the apps because I don't know. I am very old school. I use a book. Book flashcards. That's what I do. I made my own, okay? So I made my own flashcards. That is huge. I tell you guys this all the time. If you're going to study, use flashcards, because flashcards will help you and they're portable. You can make it a game. There's lots you can do with flashcards. I'm just saying. Then you need to learn reimbursement. There's a book I'm going to recommend. And then you need to know your ethics, like HIPAA and your medical ethics, and just get a good broad overview. CMS, the Medicare Learning Network that they have on there, is an excellent resource for learning these things as well. So I'm going to leave a link for CMS and check out the Medicare Learning Network, because I'm telling you guys, if you're going to learn anything, learn from there. Read, because they've got free resources there. The entire learning network is free for you to access and learn things. This is very valuable for medical coders. So I'm going to plug that one for sure. Then you need to learn about privacy, of course, with HIPAA and everything, and patient privacy and things like that. So again, I'm going to talk about a recommended book that I have. Then you can study your diagnosis coding and your procedure coding, and then like your modifiers and things like that. And also find a book on evaluation and management. I also do recommend going to emuniversity.com. They are a very good resource, and they have a free section to learn about evaluation and management. Evaluation and management is going to change sometime next year, but it's good to know your foundational basics now, because it's still going to help you, and it's still going to help you whenever you do get out in the real world and you start working with providers. You're going to be able to understand what these mean. What are elements of history? What is elements of a review of systems? What is a element of a physical exam? What is a decision-making process? What is that all about? And how does the decision to do surgery, or whether you put them on different therapies, how does that impact their medical decision-making? Can you get coding based on time? If the provider has a patient who is a very basic and straightforward visit, but this patient it needs to have some reassurance about their disease process, or perhaps they have some medication questions, and the doctor has to sit there and explain things to them, or maybe something about their surgeries, then a provider can get coding based on time, but you have to know how to tell them how to properly document. And then, so there's all of those things. I know it's a lot, but like I said, if you are putting yourself on a schedule and you are breaking it down, like say you're going to study for a year, then you can break all of these things down. How many did I say? 1, 2, 3, 4, 5, 6, 7, 8, 9. There's 9 things that I basically talked about. So that can be broken down month by month by month, or it can be broken down by a couple of weeks, depending on how fast you think that you are getting through that section. Now, I will tell you this. See, the CCA has plenty of exam prep books out there. There's so many different ones out there. Now, you may be asking me, well, what about AAPC? AAPC has some prep exam books as well. And again, if you're studying for the CPC, you can use this list if you're doing self-study as well. Because they allow you to bypass a program as well and just pay for your membership and take the exam. With AAPC, you have to pay for your association membership, and then you can pay for your exam. With AHIMA, it's not required that you are a member of the association. You just have to pay to take the test. Okay, and the CCA is their entry level for AHIMA. And with AAPC, it is the CPC. And there will be a little -A at the end, and that just means apprentice, okay? And that's for new people only. After you've had experience, or after you take their Practicode program, that A can be removed, okay? So the books that I wanted to talk about. Now, the practice exam books, whether you're doing the CCA or the CPC, there are practice exam books out there. Now, there's many good ones. I think MedPro is the one that makes the really good one. They make really good ones for almost all of the credentials, but be sure to check them out. But Principles of Healthcare Reimbursement is by Ann Casto and Elizabeth Lehman. Very good book. That's going to help you with your reimbursement thing that you need to study, okay? So that way you can learn about the reimbursement process. Just because you study medical billing does not mean you have to be a medical biller. It is part of the things that we know as medical coders to make our understanding more comprehensive. We have to understand the billing side of the house in order to really, truly know what we're doing as medical coders, right? So again, it's very important. It's a good supplemental knowledge to have, and that is a very good book. And I recommend reading it cover to cover, okay? The next one is Health Information Management Technology and Applied Approach. Again, another really good book for understanding the field and what it is. And this is by Nanette I love that name, Nanette. That's so pretty. Nanette Salas and Leslie Gordon. Okay, so those are my recommended books that you can use. Get the practice exam books as well, okay, for the CCA, for the Certified Coding Associate. Get that practice exam book. And I'm going to be doing a video next week about the different credentials, how many questions, and how long is the test. Because speed is very, very important, okay? When you are looking up codes, you need to be able to get through at a very good pace, okay? And I will be talking about that next week, the different credentials and how long it's going to take. But I'm also going to leave that link for the other recommended study resources. Now, there's study resources that you can buy in the AHIMA web store, okay, or the bookstore on the website. But they have like practice, like coding practices, and then they have where you can get the answers as well. So again, check and look if you're going to be doing independent study. And then when you get to that where you're learning about diagnosis coding and procedure coding, make sure that you're getting those books so that can supplement your knowledge. Because when you are getting those books, if you order them from Optum 360, Optum 360 Coding is where you can go to get all of your books, right? Not just AHIMA, but you can go to Optum 360 Coding. Now, this is not an ad, but I love Optum 360. Optum 360 has amazing, amazing books, and they have sales quite frequently, okay? So I will tell you that I have noticed personally, when there seems to be a holiday weekend, they seem to like to have their sales then. I'm telling you guys, that is the best place to get books that you can learn from as medical coders, or resource books if you are a veteran coder, okay? It is amazing. I'm just saying, I'm going to say that. Okay, so now the end part where I'm going to talk about if you've been on the fence about getting into medical coding or not. Ready? Ready. Okay. I'm going to give some of you guys a little bit of tough love, okay? Because I think it's needed. I have gotten so many emails within the span of 3 days. Blue, I'm interested in becoming a medical coder, but I'm afraid XYZ. Blue, I want a guarantee that when I study this, I'm going to be able to go out and get a job. Okay, let me start off by saying this first. There is no guarantee. There's no guarantee for anything. Nothing. Okay, there's a few things in life that are guaranteed, yes, and I'm not going to put them in here, okay? But I'm just saying career-wise, there's never anything that is guaranteed career-wise. Never. But there is, I can guarantee you this. If you are on the fence and you can't decide if you want to go into it or not, and you're just going back and forth because you're thinking of all of these things and all of these reasons, and then you got these people in your ear saying this stuff, and then you go to a medical coding Facebook medical group like I asked y'all not to do, and then you hear them in your ear too. Okay, here's the thing. The only guarantee that you're going to have is that you're going to be in the exact same place the following year if you don't move and do something for yourself. Well, Blue, I don't want to leave my kids and I don't want to spend so much time away from them. You know how kids learn? Kids learn by watching the adults. They look up to people. They look up to their parents. They look up to people that they admire. Now, what are the qualities that people admire, especially kids, right? They admire people that are really strong. They admire superheroes. They admire people that are cool to them, okay? Do you know what's cool? What's cool is actually having a good career that you love. Seeing people's passion is what people admire. Why do you think little kids like superheroes? Because superheroes love to save people, right? They love to save the day. It's the same thing when they see, like, you hear some kids that are really super smart, and they say, well, who's your hero? Oh, and they name, Gandhi, or they name Mother Teresa, or they name, some political figure. They name somebody, right, that truly impacts them. Like you get in like the 4th, 5th grade, and they start thinking idealistically, and what are they looking for in these people? Somebody who's passionate about what they do. They look for those philanthropists. They look for all those kinds of people. There is no reason that you can't be that good influence for your children. There's nothing that says, well, I'm going to spend a little bit of time studying and I have little kids, but that's okay because I want to provide a better life for them. I want to do good things for them. If you want to do medical coding, do it. If you are trying to decide, well, I don't know if I can get a job. Everybody says I can't get a job or it's hard to get. Yes, it's hard to get a job. It is extremely hard to get a job. And I've told y'all that. I have been upfront about that. Did I struggle to get a job? Heck yes. And I'm fairly intelligent, okay? I'm just saying, I'm not trying to toot my own horn, but I'm fairly quick. And it was still hard for me to get a job. Now, I had to look. I had to apply myself. I applied 40, 50 different places trying to get a job. It's the same for everybody. Some people get lucky and they can have somebody from like their school or whatever, and they do internships or externships and they can get a job right away. There are some people that just get lucky like that. But then there's some that you have to work hard in order to get a job. Well, I've been looking for a whole year and I haven't been able to get a job. Okay, I don't know what your circumstance was. What does your resume look like? Are you passing the interest assessment when you go to apply? Because that also makes a difference too. You have to have a good understanding of what you're doing when you are trying to apply. Because anybody can study for a test and then do well and pass an exam. But it doesn't mean they understand how to apply. Now, if you know the fundamental basics, it's going to show when you are taking these assessments, right? That you sort of kind of know what you're doing because you're brand new and you're still trying to learn. Now, yes, there are lots of places that say, oh, well, we need you to have experience. But as I've said on another video, sometimes brand new medical coding jobs are listed under different titles, not just medical coders, okay? They're health information assistants. I've seen one like that. I've seen medical records tech. I've seen records tech. I've seen, what was another one? Shoot, I had it in my head. Anyway, but I've seen several where it's not literally listed medical coder, but when you read the description, it says this person will be applying medical codes and we welcome new people and that kind of thing. So you really do have to sort of understand. I will be doing another episode about breaking down different job listings and what they mean. And because the language, you have to understand it as well. And also when you're looking at these job listings, the person who's writing the job listing isn't always a medical coder, okay? So it's maybe somebody from HR and they're just being told what the person needs basically, and then they can try to do the ad from there. But it's all about the wording. It's all about what it's saying, okay? So again, I'll probably do a video about that next week. But guys, there is no guarantees. If you want to do it, then do it. Okay, don't sit there and go back and forth. Well, what if they come up with software to, then they don't need us anymore? Do you know how long they've been saying that? They've been saying that since probably Moses wore short pants. They've been saying it forever. They said it when I started. Oh yeah, that they're gonna have all these people. Do you think I listened to that? Do you think I listened to that? No, I did not listen to that. There's a lot of pollen in the air and it's drying. It's drying me out. That's why I'm like, anyway. Now, I didn't listen to that. I didn't listen to any of the naysayers. Why? I made up my mind. I had to do it. I wanted to do it. And there you go. You can't let other people influence you to decide what you want to do in your life. It's your life. You get one rodeo. That's it. You get one and then it's done. What are you going to do with your life? What is it that you want? You want a career? Great. You want to do medical coding? Okay, good. Start studying. Well, Blue, I don't have no background in medical. You think I had background in medical? Nope. I wanted to go to law school. So I was far from medical. No, I did not have any background in medical. And I was in my late 20s. Well, I think I may be too old. No, you're not. If you're still curious enough to want to do things and you're still a studious person and you're still detailed, you can do it. Like I said, and I'll talk about that lady all day long, the one that was 61 and got her medical coding credential. And she's still a coder now, and she's in her 70s. So think about that, guys, okay? And don't let the fear of, oh, what if this happens? Oh, what if this happens? Why can't you think of something positive? Like, when I start this, I wonder how many fun things I'm going to be able to read. How many cool people am I going to be able to meet? What is it going to be like when I go to my first conference for medical coding? What is it going to be like when I have to give a class? Oh, that makes me so nervous. No. Get excited about it. Get excited about talking to these people, because the more you sit there and engage with your providers, the more excited that they get, okay? But it's all about communication, and you have to be willing to communicate, because if you're going to continually sit there and be afraid, guess what's going to happen? The next year, you're going to continue to still have that fear. And the following year after that, you're still going to have that fear. So don't let that fear drive you, okay? Don't let that fear take away what you want in your life, which is a good career, because it is a good career. So I'm just saying, okay? Now, like I said, it's a little tough love, okay? Some people may not appreciate it, and that's all right. Everybody's entitled to their opinion. But I'm just telling this to people who want to hear it. If you want to hear it, this is what I'm telling you now. If you want to do medical coding, then do it. Don't sit there and go back and forth and think, oh, what if? Then you may as well stay on the sidelines then. Because guess what? When you become a medical coder, you're going to have to be used to changes, because we get changes every single year with the diagnoses, with the procedures, with the rules. We get changes all the time. It's constantly evolving. Evolve yourself, right? And make yourself to learn something new. It's okay to learn something new. It's okay to do something for yourself, because you never know who you are going to be inspiring. Whether it's your kids, your family members, or somebody around you who's looking at you as an inspiration or an inspiring person. I'm just saying. And don't do it for them. Do it for yourself. Because at the end of the day, one thing that my aunts were mean. I will tell you all that. My aunts were all mean. And you know what they said? One thing that they can never take away from you is your education. That's the one thing that no one will ever be able to take away from you. And I'm just saying, okay? Now, do with it whatever you wish, all right? But I'm just saying, it's a good career. It's a wonderful field. If you're asking me, well, what if I, I've got plenty of advice videos, guys, okay? And that's my advice. Learn from what I've been through, okay? And I talk about my pitfalls and my ups and my downs. I do on my channel. Take the time, watch my videos, okay? I'm just saying. I'm going to wrap this one up before it cuts me off. But have a great weekend, guys. I will be back next week. I will be posting the schedule for next week's videos on Sunday. I look forward to you guys joining me. Thank you so much for taking time to listen to me and to ask your questions. And please ask very detailed questions. And please go through the videos before you send questions in. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.